So today we are going to talk about median nerve. So median nerve, root value C5T1. Now, in other words, laborer's nerve. Why laborer's nerve? Because it supplies most of the forearm flexor muscles. Now, we'll look back into brachial flexors. Brachial flexors will divide into root, trunk, division, cords, and branches. Now, brachial flexors will give main 5 nerves in the upper limb: musculocutaneous, axillary, radial, ulnar, and median. Now, the lateral cord will give origin to the musculocutaneous nerve. The posterior cord will give origin to the axillary and a radial nerve. Medial cord will give origin to the ulnar nerve. But if you see the median nerve is originated from the lateral and the median cord. So you go back to the lateral and the median cord, and if you see, the root value will come as a C5 to T1, whole brachial flexors. Now, median nerve is both sensory and motor. So, motor part supplies the, as I said, forearm flexors, except flexor carpi ulnaris and a medial part of FDP, flexor digitorum profundus, and thenar muscles is also supplied by the median nerve, and a lateral 2 lumbricals. Sensory part of the median nerve is palmar cutaneous nerve, or palmar cutaneous branch of a median nerve, and digital cutaneous branch of a median nerve. Now, median nerve enters the upper limb from axilla or the armpit, goes through the cubital fossa, and median nerve will divide into 2 parts: anterior interosseous nerve and palmar cutaneous nerve. Now, anterior interosseous nerve supplies all the muscles. Now, I'll say pronator teres, flexor carpi radialis, palmaris longus, flexor digitorum superficialis, but flexor carpi ulnaris is supplied by the ulnar nerve. These are 5 superficial. Now, 3 deep muscles: pronator quadratus, flexor digitorum profundus, but again, the lateral half. The median half is supplied by the ulnar nerve, and flexor pollicis longus. Now, palmar cutaneous nerve passes over the carpal tunnel and supplies the lateral 2 lumbricals and innervates the lateral palm. Recurrent branch of the median nerve supplies abductor pollicis longus, opponens pollicis, and flexor pollicis brevis. Now, there are 2 flexor pollicis. Brevis is short and longus is a long part. Both are supplied by median nerve. Sensory loss will cause pain, numbness, and tingling in this area. Now, carpal median nerve can be damaged at 2 different parts. The proximal part at a cubital fossa, where it can be damaged due to the fracture of the humerus, will lead to hand of benediction. So what is hand of benediction is this: if you ask the patient to make a feast, patient cannot flex MCP and IPs of the index and middle finger. Now remember, flexor digitorum superficialis is supplied by the median nerve and flexor pollicis longus. So patient cannot use these muscles, but median part of the flexor digitorum profundus is supplied by ulnar. So we'll give you this sign. Now, distal injury at a median nerve will be in the carpal tunnel. Now, carpal tunnel can be caused by infection, pregnancy, inflammation due to overuse injury, hyperthyroidism, and mostly idiopathic. Now, that is the hypertrophy of a transverse carpal ligament. Now we'll see the pathophysiology. Median nerve injury at the elbow, that is at the cubital fossa, and distal at the, will give to hand of benediction, and distal at the carpal tunnel syndrome. Carpal tunnel syndrome will lead to prolonged wasting in the thenar eminence of the muscle and will lead to 8th thumb deformity, where patient cannot move the thumb. Now, we have to see the signs and symptoms if you see the diagnosis. So see the signs and symptoms: 2 obvious signs: hand of benediction and 8th thumb deformity. Now, physical examination is by the Phalen's maneuver. Ask the patient to bend the wrist, so the median nerve is compressed at the wrist. And second is tenal sign, where you give a percussion at a median nerve will reproduce the same signs and symptoms as a carpal tunnel. Thank you.